we had discussed quite a lot of things when and how you're going to recognize a sick child in our last discussion. Today I'm going to concentrate on something else. We are discussing sick child again, but we will talk about something like cough. Cough is a common problem. It happens to everybody, and I can't think of any chamber of mine where I haven't had a patient with cough and cold. So cough and cold is very important, and cough and cold is usually very, very sort of, I would say, very benign. It's a thing which happens to almost all children all the time. But there are certain times when we really need to get worried with cough. First of all, if the cough is associated with very high fever, if the cough causes loss of daily activities. So in other words, the child is coughing so incessantly that the child is not able to keep the food down, vomiting after the cough. If the child becomes very lethargic after the cough, after a bout of cough, if the child's cough is spasmodic, it comes on and gets on repeated, and it subsides down for a couple of minutes, and then again he starts coughing. These coughing bouts are pretty harmful for children. If the child coughs more in the late hours of the night and in the early hours of the morning, that has got a special significance. But most importantly, as parents, what you should be absolutely careful about is your child having difficulty in breathing at the same time? And how do you understand that? Normally we breathe around about 20 to 30 per minute, approximately. In a smaller child, it would be up to about 30, 40 sort of breaths per minute. In a small baby, it will be 40 to 50 breaths per minute. But the pattern of breathing would be, that's a normal breath. But if the child is breathing rapidly, that's called tachypnea. In other words, the child is breathing excessively in order to cope with the demands. In other words, to get the oxygen, the child has to breathe fast. Then there are certain things, certain muscles of respiration which we would normally not use. They become active. We call them the accessory muscles of respiration, which become active when there is a labored breathing, when the work of breathing is more. When the child, say for example, has a pneumonia and the lungs, a part of the lungs is not working at all, and the child has to breathe. So the child will breathe like, sorry, I'm coughing. So the child has to breathe like this. And this indicates that the child is in distress. We call it a respiratory distress. When the muscles, accessory muscles of breathing, which are located on the neck and on the chest, they are visible. So you see a child breathing fast, you'll find the chest going in and out, in and out, in and out. And that's called suction, intercostal suction. This part might go in, that's called suprasternal suction. So these things will alert you that your child is having a bad cough and possibly a very pathological cough which needs urgent attention and investigations. And what is it that you can do if you can see this? Or if the child becomes blue, I'm sorry, I forgot to tell you that. If the child becomes suddenly blue, cyanosed we call it, that's bad news. If the child becomes very lethargic after coughing, it's a sign of exhaustion. In other words, the breathing apparatus is getting exhausted. So that's bad news. So whenever this happens, what are you supposed to do? First of all, call for help. In other words, you need to ring the doctor. You make sure that this child goes into the hospital or into the clinic as quickly as possible. In the meantime, make sure that the child is upright. So raise the child up. Make the child sit up with pillows supported. If you have got an access to oxygen, of course, that's going to help, but you wouldn't find it at home. So make sure that if you have got inhalers, if the child is already on inhalers or bronchodilators, you give about 4 puffs of that through a spray, if the child is on it. If not, then all you have to do is make sure that the child doesn't have anything by mouth, because the child might aspirate during this process of rapid breathing. And the next thing is your phone call to the hospital. You must go and see a doctor. Another condition which sometimes devastates parents is the occurrence of fits in children. fits are as common as about 15 to 18% in children. So a fit is going to happen in about 15 children out of 100 sometime in their lives. And it's usually associated with fever, or if it is not associated with fever, sometimes some of these children grow up to have a condition called epilepsy. But I must assure you that not all fits are epileptogenic, in other words, are going to produce epilepsy. And most of them are really benign fits, but they produce a catastrophic experience in parents. And what typically happens, especially with febrile fits, children have very high temperature, and within 24 hours of the onset of fever, at the height of fever, usually the children start moving their hands or feet, rolling up of the eyes. Sometimes they vomit. There's a deviation of the angle of the mouth, and it looks pretty bad. And subsequently, the child loses consciousness and flops down. So it's imperative that the parents know how to treat this condition if it happens suddenly at home, whether it is associated with fever or not. If a fit ever happens, the first thing which needs to be done is the child should be put down on the floor on one side, preferably the right lateral side, on the right side. Nothing should be put inside the mouth. There shouldn't be any pillows. You shouldn't try to prepare a drink and feed the child or put a spoon inside the mouth. This is definitely going to cause a lot of problems. If the child has got fever associated, you can strip the child and give a cold sponging on the bed or even the floor wherever the child is lying. And there are certain medications which can be given during the fits, but they have to be given through the nose. But I'm pretty sure that until and unless your child had a fit before, you're not going to keep those medications at home. But if it's an institution like a school or somewhere or a place for a play group or somewhere where they come across children who have fits, they might sometimes carry a nasal spray which may be injected. But as parents, you should recognize the fit, not feed the child during the fit. Do exactly as I've told you. Lie the child down on the right side and cool the body temperature if at all the child has got a fever, and alert the ambulance, and the child needs to go to the hospital as soon as possible. That is very important. Thank you very much.